Hello everyone, I am Dr. Rohan Khandelwal. I am a surgery faculty and I'm joined today by Dr. Vinayak, who's also a surgeon and he's done his MRCS as well. So the topic of discussion today is regarding the MRCS exam, its utility and its scope in India and abroad. So we are coming up with an app called Mortimer Green where we have a question bank for MRCS and we're starting with live lectures as well for MRCS. So MRCS is member of Royal College of Surgeons, and this is basically the entry-level exam which gives you the GMC membership, the General Medical Council membership, which can enable you to then practice in UK. So, Dr. Vinayak, when did you appear for the MRCS exam, and what was the reason? Why did you appear for the MRCS exam?
So to be honest, I initially appeared for my MRCS exam because I thought it was a cool thing to add behind your name. So I appeared for my exam, the first part, part A, when I was a second year resident. This was way back in 2017, and I did my part B in 2018. In my early part of my third year of my residency, I was a general surgery resident at Madras Medical College. It was a pretty hectic residency, but I never really thought that that was a barrier to doing MRCS. So initially it was just a cool factor, but later on, as soon as I finished MRCS, I realized that a lot of hospitals, not in the UK, I'm just talking about India, in cities in Delhi, in Chennai, they kind of value the degree quite a bit. So I started motivating people, my friends, to do the exam again.
Yeah, so it happened pretty much in the same manner for me as well. That at Safdarjung, I think so. All of our seniors, there was a trend of appearing for the MRCS exam, and we also appeared for part one. I appeared for part one towards the end of my first year, and the final part we gave as soon as we finished our final MS exams. Of course, in our times there was part one, part two, and part three. Now it is part A and B only. So the part A exam is the MCQ exam, which is an intercollegiate exam. Now a lot of queries have come to us regarding this intercollegiate exam. So there are a lot of royal colleges there are multiple colleges which are there. So you have the College of Edinburgh, Glasgow, England, and Ireland. So there are four royal colleges. So the first exam is standard for all of them. So if you appear for the first exam, the intercollegiate exam, then you can choose part B, you can appear for any one college. Now this part A exam is a combination of basic sciences and a combination of core surgical principles. So it's divided into two parts. Dr. Vinayak, why don't you elaborate on it and tell the listeners more about the exam?
So the exam is a 5-year long, it's a single day exam, 5 years long. It's split into two parts. The first part is basic sciences, which is anatomy, surgical physiology, surgical pathology, surgical microbiology. And the second part is principles of surgery in general, where they cover GI surgery, thoracic surgery, basics of pediatric surgery, breast surgery. Trauma surgery is given a lot of importance, a little bit of critical care. So this is called as principles of surgery in general, and this is for 120 marks. So the first part is for 180 marks, and the afternoon half is for 120 marks, and overall it's 300 marks. So passing the exam is not about clearing a certain score. It depends on how well your peers in the group exam do it. So usually on an average you need to score more than 210, that is more than 70% in your exams to secure a comfortable pass. Some years it's 69, some years it is 72, but overall it's around 70. But 3 months of preparation, I think you can kind of get a score comfortably around 80s. Not too difficult at all.
So there is no negative marking. That is one
big advantage.
Yes, that's a big advantage. And 3 months of preparation, as Dr. Vinayak said, is good enough to crack the exam. So when we talk about preparation, the basic sciences part, there's a book called Raftery, which everyone refers to. And in addition to that, you can solidify your concepts by listening to videos from various sources. Even Mortimer Green is going to come out with video lectures soon and live video discussions. Part B and I'm sorry, not part B, the second part, which is the applied surgical part. Bailey is, the Bible of surgery when it comes to any UK-based exam. And in addition to that, you also have to strengthen your concepts of orthopedics, something which is a bit weak for general surgeons. And if an orthopedician is appearing for the exam, then they have to read general surgery.
Surprisingly, we tend to find that orthopedic surgeons, they kind of put in a little more effort and tend to pass the exams a little more easily. It's surprising, but the last 2-3 years of experience, of training people in MRCS has taught us that if you're sincere, your specialty is not a major impediment. The other interesting fact which I want to convey is that you really need not be a surgery postgraduate to do your MRCS exam.
Correct.
You can be a post MBBS with an interest in surgery, or if you want to, kind of move to the UK. There are two routes. One is the PLAB route, of which we're not going to talk right now. The other route is the specialist registrar or the MRCS route, where you can kind of do your MRCS Part A and Part B while working in a surgical environment, surgical department somewhere, or even as a JR, and kind of make the shift to UK. It's not an ideal route because you don't get into core surgical training, but it is another way of getting into the UK. Yeah. What do you think about that, sir?
No, there are a lot of students who approach me who say that, we've done 6 months of junior residency or JR-ship in a surgical department and we want to do MRCS. So I always encourage them that, you should take this route. And the advantage is that if you clear your MRCS, you get a GMC registration, and then you can enter your training.
Absolutely.
So we were talking about the scope. Like Dr. Vinayak said, of course, the cool factor is there that you get an added degree. And I truly felt that this was a very wholesome exam, and you really felt great after passing the exam. The second thing is, in terms of scope in India, as Dr. Vinayak said, a lot of corporate hospitals give this a lot of value. And, if you're applying for a job, you might be preferred over another candidate who doesn't have MRCS. In the Middle East, if you're planning to go to UAE, in Middle East, if you have an MRCS degree, your salary package becomes 2 to 2.5 times that of a person who doesn't have MRCS. So another major advantage there. And of course, this is the entry level for UK, where if you have your MRCS exam, then you can land up with a surgical job in UK as well.
So just a caution, the MRCS degree does not make you a consultant in the UK. It's an entry to the training process, a longer training process, at the end of which you obtain an FRCS. But like sir told, it makes a huge difference when you're applying for jobs in the Middle East or in any other part of the other parts of the world, because it's a very internationally recognized degree which gives you a solid credentials. Because in our Indian curriculum, we never teach students how to break bad news, how to tell a patient that something is wrong with their father or mother. So on a very holistic level, as sir told, the experience was very satisfying. As soon as I finished my exam, I felt that I was a better surgeon, definitely, because it's not just the surgical part of operating part of it. It's the fact that you know how to convey a bad news. You know how to order a patient in a OT list.
Right.
It taught us very simple things like, if there's a diabetic patient, you put him on the list or not. In our surgical training in a government medical college, these are not things that were ever emphasized. Correct. So I felt that the entire process of going through the examinations, irrespective of you following a career in the UK or not, makes you a better surgeon.
Absolutely. And also one more thing, if you plan to do fellowships in UK, especially a lot of orthopedicians or vascular surgeons like to go to UK for some time to do fellowships. So there also you need to get a GMC registration, and for that you need to have your MRCS degree. So that was regarding part A. Part B is the practical exam or the OSCE exam. And Dr. Vinayak, why don't you briefly tell them about part B exam as well?
So the part B exam is similar to your OSCEs. It's not similar, it's actually the OSCE stations. So we have a series of stations where they have an anatomy specimen or an atlas chart where you're asked to identify the organs. They ask you questions on that. There are pathology stations. There are skill stations where you're asked to, do an incision and drainage of an abscess. All simulated models, not real patients. There are stations where you are asked to obtain a consent for endoscopy, break bad news to a patient, or, funny situations like this, the CT scanner machine is broken down and the attenders are angry at you because they want a CT scan scheduled immediately. It's a kind of a mixed bag where they test your overall skills as a surgeon, not just in operating, but also in areas of critical care. There will be stations on examination as well. B1, this examination includes stations in ENT and orthopedics as well. So you will have to brush up your post MBBS skills or your internship skills as well again.
Yeah, so as he said, it's a very holistic exam where you have communication skills section, and you have communication skills sections, and you have actual core clinical stations as well. And again, we feel that around a month to month and a half of preparation for the Part B exam is sufficient. And Dr. Vinayak does organize some sessions in Chennai for Part B training.
We are doing it actually online this time. I mean, last 4 times out of 4, I think over 2 years we have conducted 4 sessions, and only one of them was offline. The other 3 sessions were online, and we have an excellent result. Yeah, obviously due to COVID. We had scheduled a session in January in Chennai, but because of COVID, we had to make it online. And I'm very happy to say that most students, the July session we had one, and we had 4 students training. It was a very small batch, 4 students who trained, all of them went to the UK, and we had a 100% pass. So I think that was great. When your students do well at the end of the day, and they're able to establish careers in UK. And in this workshop, we kind of go holistically and teach you stuff which other people also are hesitant to teach, like stations such as ECG for surgeons and how to build a career in UK. And our course for Part B is focused extremely on communications and history taking, because that is an area where Asian and Indian students
are lacking
and kind of tend to fail because our training does not emphasize that.
Sure. So for the Part A exam, you can apply online by visiting the Royal College website. And like we said that at Mortimer Green, we are coming up with a Q-Bank, we are coming up with live discussions and also video lectures, which would help you for both Part A and Part B. So if you like the video, please do press the like button and drop us a comment. And if you have any further queries, please write it in the comment section and we'll be happy to help you out. Do try out the free question banks on the Mortimer Green app. You can download it free from the PlayStation or the Apple iStore. Thank you.
Thank you so much.